If you're like me, you have a living will. And if you're like me, you probably have no idea where you put it. And if you're like me, you have only the vaguest recollection of what you put down. Now, living wills, however, were a great movement. Many people in this country would die really long, prolonged deaths in intensive care, hooked to machines, spending a lot of their family money on futile treatment. And the idea behind a living will is to give you some control over your terminal illness. And that's a wonderful thing. However, studies have shown that most living wills are not that effective. Doctors usually do what the family says. And that kind of makes sense because the family probably knows your situation better then than you did 5, 10 years ago when you were making out your living will. However, it's still a good idea to have one. But a much more important document to have is what is known as a durable healthcare power of attorney. In your state, they might be different, a different name. However, what they do is they allow you to appoint an agent, hopefully have a backup agent, to make medical decisions for you if you are unable to do so. And unlike a living will, which only kicks in when you are terminally ill, it is effective anytime you are in a position where you need medical care, but you can't consent to it. Now, you should get a lawyer to fill this out for you because they will give you more bells and whistles. Your agent can come to the hospital and shout at the doctors to make sure you're getting the kind of treatment that you wanted to get. When you're talking to your lawyer, before you talk to your lawyer, you should have a clear idea about who you want to have as your agent and maybe your backup agent. A lot of people kind of routinely put down their spouse. Probably that's not the best of ideas because think down the road when you might have to actually use this, maybe your spouse will not be in any condition to make rational decisions or to shout at the doctors. The other thing you want to talk to your lawyer about is the powers the agent has. Does the agent have the power to sign you up, to send you to a nursing home? And that is an important power because sometimes a nursing home won't take people unless their agent has that power in the document. Another thing to look at is whether or not the agent has the power to withdraw you from life support. And again, I think for a lot of people that's a very important power to have. Now, the most essential thing with a healthcare power of attorney is to actually spend some time talking to your agent, telling them what you want and what you don't want. This could be part of a larger family conversation, or it could be just with the agent. A couple of things that I talk to my agent about. First of all, you got to insist from the doctors to get a prognosis. Is this a terminal condition or not? Oftentimes doctors, for many reasons, don't like to give bad news. So you got to push them. One thing that's true about hospitals is there will probably be several different doctors caring for me because of different conditions. So part of my agent's job is to find out who's in charge and to find out what the prognosis is. Now, if the prognosis is good, that I'm going to be coming home, what I would want them to do is to talk to the doctor about what kind of condition am I going to be in. Many people just think about, I don't want this condition, or I don't want this treatment, I don't do this treatment, don't do that. What I advise you to do is to think about what kind of life you want to have. I, for example, told mine, I'm perfectly happy to live in a wheelchair and have certain disabilities. What I would not like to live if I no longer knew my family, my friends, or could no longer keep abreast of current events. That would be my choice. Another thing I told my agent was to insist that I got enough pain medication. I'm a wimp. Some people will say, no, I'd prefer not to have a lot of pain medication because that will make me less conscious of what's going on. But I told mine, get that pain medication. And the last thing is, if it is a bad prognosis, I told my agent that I would prefer, all things being equal, to die at home in hospice. So that's a healthcare power of attorney. Now, what if you don't have a healthcare power of attorney? Well, most states have a Family Agency Act that says will appoint someone that will make that decision will act as your agent. The problem with the Family Agency Act and why you should actually have your own health care power of attorney is that the Family Agency Act may not name the kinds of people that you want to represent you. For example, most of them start with your spouse and then your kids. And again, maybe your spouse is not a good idea. And for a lot of people, if they're unmarried, for example, or if they're a gay couple, they're not going to be listed on that list, the Family Agency Act. So it's important to name your own agent and again, speak with them. Another document I'll briefly describe to you is known as a DNR, Do Not Resuscitate Order. Several years ago, a friend of mine who was a physician came to my elder law class and explained that when he was in the hospital, part of his job was to convince elderly patients to sign a DNR. And my students were really shocked when they heard that, and I was kind of shocked. And they were saying, that's horrible, you're getting people to kind of consent to their own death. And the doctor listened to them for a while, and he finally said, have you ever actually seen what we do when we resuscitate someone? And they said, yeah, we've seen it on television. You run in and you zap somebody, and then they get better. And in fact, I think it was a study that showed that 90% of the people that are resuscitated on television get better. In real life, it's like 20%. And of that 20%, a lot of those people die fairly shortly in any event. It is a fairly intrusive, a very intrusive procedure. So a DNR might be right for you. I know a lot of elderly people who are living in home and they don't want to be revived if they have a stroke or if they collapse. They don't want the paramedics coming in and resuscitating them. So what they do is they have a DNR form that they fill out and they put in the freezer of their refrigerator. And a lot of paramedics will probably look there. Another way to deal with that problem, and I'm not really advising this, but some elderly people will advise the people that are taking care of them, look, if I collapse, don't phone 911 real quick, because I don't want the paramedics to come and revive me. My time is up, my time is up. Now this has been a fairly gruesome discussion. Hopefully none of this will come about. You know, if you're lucky, you're going to get run over by a bus.